My next guest is so interesting. She is Dr. Nora Volkow, the director of the National Institute on Drug Abuse at the National Institutes of Health. It's the world's largest funder of research on the health aspects of drug use and addiction. Dr. Volkow has pioneered the use of brain imaging to examine how substance abuse affects brain function. I had the opportunity to speak with her earlier.
Dr. Volkow, thank you so much for joining us today. And I know that this is a subject that we're all discussing now as cannabis comes online in some states and people are looking at the federal government for direction one way or another and how it's eventually going to be regulated. But what I'm interested today is the science and what we've learned about how the brain functions, how the brain is affected when you introduced those chemicals that are part of cannabis. You're so well known for using brain imaging to look at substance abuse and how it affects brain functions. What have you and the Institute have been learning about cannabis and its effects on the brain?
Well, first of all, Steve, thanks for having me, because I think that it is crucial as the states go on legalizing marijuana that we actually take advantage of science and the knowledge that it derives to help guide policy, because ultimately what you want to do is to do policies that minimize harm to people. And when it comes to drugs, we know the concept that that drugs actually, when people take drugs, there is a consequence to their biology that actually is important for them to know. And I think that this came very clearly with tobacco, where people actually not knowing that smoking cigarettes were actually could produce cancer, did not take precautions that could have actually obviated a lot of the harmful effects. So it is our obligation to provide the science and knowledge so that people, as these policies are happening, that there is knowledge that can get individuals a perspective of whether they should be taking the drug. And if they take the drug, what are potential negative consequences? Because without that knowledge, you really are in the dark. And we have seen, obviously, with the legalization of marijuana across multiple states, a push towards changing beliefs in people that marijuana does not have any negative consequences, even though at the same time, there's no evidence that has given us that security, that white blanket. But there is evidence that absolutely, in certain situations, cannabis, again, can have negative effects, while at the same time recognizing that cannabis is a product that has multiple chemicals, and the effects of these chemicals in certain instances may have potential for therapeutics. So it's not a black and white situation, and knowledge can give us that insight. What have we learned? We've learned an enormous amount of things about the issue of cannabis. We know how it affects the brain, how it affects our physiology, because we have our own endogenous cannabinoids, and they are very important for how our immune system works, how our brain works, actually importantly, how our brain develops. And in particular, we as an institute, the National Institute on Drug Abuse, has been focusing on the effects of cannabis in the brain. And when we're doing the work on cannabis, the work has been mostly concentrated in two chemical compounds on cannabis. One of them is 9-THC, which is the one that people seek out because it actually makes you feel high, it creates a sense of reward and well-being. And the other one is cannabidiol, or CBD. And there's been an enormous amount of interest because CBD can reduce anxiety and can have analgesic effects. The notion, though, is CBD is not rewarding, and it can actually, in some instances, antagonize the rewarding effects of THC. So most of the products that are sold out there in the illicit market for reinforcement, for recreational purposes, by default will have low content CBD, but high content THC. And the variety of products ultimately does affect the effects of marijuana. So the products, for example, what we have been learning is that the amount of THC has been increasing significantly on marijuana that is sold for recreational purposes, which again reflects the fact that it's going to create a marijuana.
Well, and I don't mean to interrupt, but I mean, I just want to ask you, Nora, that high degree of THC, is that one of the concern points you have? Because you're one of the world's great experts on addiction. So is that, and I think there's this belief out there that cannabis is not addicting. So I just love it. Can you just zero in on that in addition to the other things you were saying?
Good point. Thanks for interrupting. And indeed, absolutely. The higher the content of 9-THC, the greater the risk of adverse consequences from smoking marijuana. So for example, yes, the higher content of 9-THC increases the risk of addictiveness. And there is absolute evidence that marijuana can produce addiction. Not everybody that smokes marijuana becomes addicted. And research, of course, is ongoing to try to understand who's vulnerable to this addictiveness. But the higher the content of THC, the greater the risk. Also importantly, the higher the content of THC, the greater the risk of adverse medical consequences. And what are the adverse medical consequences of high THC marijuana? When one of the most severe is an acute psychosis. And this psychosis can actually result in hospitalization, and in some instances are long-lasting. And again, this is of concern, and of a greater risk are people that have a family history or a predisposition for psychosis. Another medical negative effect of the consumption of high THC is what we call hyperemesis syndrome, where an individual has extremely intense abdominal pain and cannot stop vomiting. Additionally, and again, these adverse effects from marijuana are accentuated by the high content of 9-THC. But that's why the research, a lot of the research has been focused on either understanding THC or understanding CBD, because there is interest on developing therapeutics that use CBD for a wide variety of conditions. And within this context, also the Institute has predominantly focused on the effects of cannabis on the development of the human brain. And why is this so? Because as I mentioned at the beginning of our interview, the endogenous cannabinoid system is involved, manages, orchestrates how our brain forms. And that includes, for example, where do neurons migrate as your brain is forming? What are the connections that are formed? Actually strengthening those connections. So the concern obviously is if you are taking marijuana and you are artificially stimulating this process necessary for brain development, could you actually jeopardize its outcomes? And this is a work ongoing and relates also to the consumption of cannabis during pregnancy that actually, unfortunately, does cross the placenta and it does actually get inside the neonate to understand what potential negative effects it has. So research shows that it is deleterious to smoke marijuana during pregnancy, and it is also associated with negative outcomes, the use of marijuana in childhood and adolescence. That's clear cut.
So you're describing, a great deal of life complexity around us, a great deal of variation. And you and I, and just tell our audience, you and I have had these discussions before about substance use disorder, addiction across other drugs. And I think one of the interesting questions is whether or not, as we enter into a world in which cannabis is going to seems to be becoming more and more part of a lot of folks' lives, whether the institute where you're at has the resources to think through these complexities, to work with the health profession, to work with the policy community, in helping to guide people in this, because it sounds like we're there in many ways before the science and the results of your work has come forward. Am I getting that right?
Yeah, no, absolutely. And I guess that you are hinting at the notion, particularly, for example, as people are using marijuana for medical purposes, there's a wide variety of conditions that people are using it for, or that the dispensaries are selling them for, even though the evidence is not there. And thus, they may forego medications or treatments for which there is clear-cut evidence because of the belief that marijuana may help them. And so, therefore, this highlights really the need to conduct more research so that we can understand ultimately what cannabis can do or not do, and when it can be harmful.
Well, the other thing I've always admired about you, and I just want to put it in this, is that I don't know how to open it other than just bluntly. You have written about and commented about that we need to remove stigma from the issue of those people who are suffering from substance use disorder, who are suffering from addiction, which you see as a brain disease. Tell us more about that, if you wouldn't mind, because I think it's important for our audience to understand that in a way, if you're suffering from a disease, that individual is as much a victim of that process as others. And then to criminalize really gets you nowhere good. But would love to hear that from you.
Yeah, no, I think that the stigma that has surrounded and continues to surround addictions and the use of drugs has actually jeopardized our ability to intervene both on prevention and treatment. Our society overall has criminalized people that take drugs, and this has been shown repeatedly that it's not only not beneficial, but it actually exacerbates the outcomes of individuals that are put in prison or in jail for the use of drugs in terms of their drug use itself, but also on the likelihood of relapsing when they go back to the communities. And the other aspect about it is not only it is negatively affecting them, it's also affecting their families. And I think that a big concern has been too, the issue that criminalizing the drug users has also exacerbated health inequalities by promoting incarceration of certain groups. So it's very, very negative as it relates to how we have criminalized drug users. But also that stigma has interfered with the healthcare system to actually engage in the screening and proper treatment of individuals, whether they are early on the stage of a substance use disorder where an intervention can help them and prevent them from escalating, to intervening individuals that already have a moderate or severe substance use disorder that currently, if not treated, could actually have a high risk of very negative outcomes, including death.
Let me ask you finally, Nora, around alcohol, for instance, we have guidelines. We have guidelines on, the age that people can buy products, how they can be responsibly used and imbibed. I mean, we have an infrastructure out there that's been informed by research, in part by your institute. I'm interested in what you need to further the research so that states and the federal government get the kind of inputs they need. Are there barriers to you doing the kind of research on the cannabis front that we ought to know about so that we can kind of get to a fully fledged, robust thing of where the no-go zones are, where the, hey, go carefully or go enthusiastically to kind of help us understand as people looking at cannabis and its both positive and disconcerting dimensions, what do you need to kind of fill out this picture?
Well, I'm just going to be cautionary here because the evidence as it relates to therapeutics of marijuana are actually limited to specific products and to very few conditions. So that and again highlights why we need to do research. But one of the barriers that has actually been noted, and I've testified, is that cannabis, marijuana, by being a Schedule I substance, requires certain procedures that actually quite be very lengthy. And in some instances, detracts researchers to want to investigate it because it's just much more cumbersome than doing studies with other substances. I can testify to it as a researcher. I always hesitate to go into doing research with Schedule I drugs because as is to do, and I do research in human subjects, it's much more cumbersome. And this is what we hear also for our grantees, that it takes much longer to get the approval in order to initiate the research and is more costly. And that actually delays everyone's progress and makes it, again, deters researchers and scientists to jump into this extremely important area of investigation because people are taking marijuana and there's really very little evidence. So that's one of the aspects that has delayed it. Another aspect that has slowed down our progression in science is because of the national conventions, the United Nations Convention on Control of Drugs. The cannabis that is available for research that is funded through the government has to be provided by NIDA. So we are overseeing the production of marijuana that then researchers work with. But this is very limiting because you can imagine that there's a wide variety of plants out there with very different properties. And so to the extent that we are limited to just one product, that actually in many ways defeats the purpose of understanding the components that are responsible for therapeutic benefits. So this is something that we have been working with, and there are new provisions by the DEA to expand the sources for where researchers can get the marijuana, which would help us overcome this issue. And another one too, it has been very difficult, for example, to researchers that are funded through the government to go into the dispensaries and investigate the products that are being sold to consumers and understand what are the characteristics of those products, which of course is crucial to understand potential negative or therapeutic effects if you cannot get your hands on it. So those are some of the main roadblocks in doing research with marijuana.
Nora, I would be remiss in not adding one last question to this that doesn't have to do with cannabis, but has to do with your very important work on other forms of addiction and your research into that. And what I'm interested in is the opioid arena, in which we've had previous discussions on what the state of the nation is at this moment. Are there blind spots that we have that we need to remove to better help those people that are suffering from opioid addiction and substance disorders? And looking at, I just love to get your, a snapshot of your thoughts on how we can be smarter where we are as a nation, because I just sort of see and feel the numbers out there of a lot of desperation out in the world and a lot of problems on that front. But your thoughts?
Yeah, no, and it is actually the latest numbers that came from CDC that actually recorded the number of deaths that end up in April 2021. During 12-month period, there were more than 100,000 people dying from overdoses. And this is by far the highest number that we've ever seen. 75% of those overdose deaths are associated with opioids, predominantly with fentanyl, which is a very potent synthetic opioid that, because it has a very high profit margin for the illicit drug dealers, they are using it to contaminate a wide variety of drugs. And so by contaminating a wide variety of drugs, for example, they are also contributing to the significant increases that we're seeing in mortality from people that are taking methamphetamine, or from people that are taking cocaine, or even from people that are taking heroin. So the market is being contaminated with fentanyl. And last week or 2 weeks ago, we have also the first clear-cut evidence report that marijuana had been contaminated with fentanyl. When people that take drugs that are not opioid, by pure chance, getting a product that is contaminated, consume fentanyl, they're at a much greater risk of dying because they actually don't have the tolerance, and fentanyl is so potent in producing respiratory depression. So what can we do? From the perspective of therapeutic is provide access to treatment to people that are addicted to opioids. And there are very effective medications out there that can prevent you from overdosing and help you achieve recovery. So there are treatments that work, but we're not providing them to all of those that need it. And again, being very conservative, when you ask me, well, how many people are getting these medications that are life-saving, I would say I'm being very generous by saying 30%. So as a country, we have tools that could be beneficial to help people prevent overdoses. Also, we should also expand the access to naloxone. Naloxone is a medication, almost like, I like it like a miracle drug, that if you are able to give it to someone that has overdosed from an opioid, you can save their lives. It reverts it. It pushes fentanyl out of the receptors in the respiratory centers, and that leads you to breathe again. But there are differences on how the states are providing access to this medication, and we should make it widely available. No restrictions on access to naloxone, no restriction on access to treatment, and facilitate that. And coming back to your question, also at the same time, in parallel, get rid of this stigma, because it's just making it much harder for people that are struggling with addiction to get the treatment. And it's actually basically puts barriers to provide the resources necessary for people to succeed. And again, just putting them at risk right now. Having a problem of substance use disorder in this country puts you at high risk of an overdose because of the type of drugs that are out there. And yet we have tools. So it is that notion of changing the stigma, putting the resources, educating people about it, and making it clear that treatment works.
Well, Dr. Nora Volkow, Director of the National Institute on Drug Abuse, I always learn from you, and I'm grateful that you shared these candid views and thoughts, on just how we get it right. How do we get the guardrails right? How do we get, folks moving where they want to go, particularly on cannabis and others, but without necessarily creating lots of new harm and other negative impacts on society. Thank you so much for your research. We will check back in with you as the science progresses and as we learn more. Thank you very much.
Steve, thanks very much.